Have you met Nigerian aunties in care homes? There's something about care work to Nigerians. It doesn't make sense. Care work and Nigerians are like 5 and 6. They think some Nigerians, they think they've arrived if they are carers, and they tend to bully you if you are young or you are a bank staff, because I was bullied because I was a bank staff and because they were permanent staff. A lovely day to you, beautiful people out there. Welcome back to my channel. My name is Sonia. If you are new here, I am a mom, I'm a content creator, I am a student nurse, and my family and I, we live in the United Kingdom. So we're a Nigerian family that lives in the United Kingdom. Guys, if you've not subscribed to my channel, please do subscribe to my channel and put on the bell notification. So thank you for coming back. Thank you for stopping by. As you guys know, you've seen the title of this video. So this is like, well, a story time, a rant, a chit chat. So yeah, it's a beautiful day. The weather is not so bright as I am looking bright, but yeah, we're thankful and we're grateful to God for his mercy and his goodness, for the gift of life. So yeah, let's get right into today. Okay, I'm gonna give like a background a story so you guys understand what I'm saying. You know, when we Africans come into the UK or even the US, Europe, the first thing we are told is, oh, care job, care job, care job. So when I came into the UK, the first thing I was told, oh, obviously my parents wanted me to go to school, they wanted me to go to college. So yeah, I went to college. I enrolled for health and social care. So that's like the most populous, and I don't know if it's the easiest course, but that's what most people go to do in college. Most black people that I know, you know, migrating from Africa, from Nigeria. So I went to college and I started I enrolled to do health and social care. So mind you, before I left Nigeria, I was already at uni, and I had my is it GCSEs? In Nigeria we call it WAEC and NECO. So I actually gave them at college, and they said it wasn't equivalent. They couldn't match it up with, you know, the grades here, because when I got there, I saw some Nigerians as well, young girls like me, and they say, you know what, we're in health and social care, we're in level 2, we're in level 3, it starts from level 1. So they were like, oh, don't even bother going to level 1 because it's like you're starting from scratch. So I actually told them I want to start from level 2, and they said, so I met a lady, she's Zimbabwean, and she was like, you know what, Sonia, I would advise you to start from scratch. I would advise you to start from level 1. I kind of felt bad. She said I'm going to learn so well. So yeah, I had to start from scratch. So I started from level 1 health and social care, and immediately I started, you know, health and social care is all about care, you know, taking care of the elderly, social care and health, about young people. It's just basically health and care for people. Yeah, so we're taught dementia, we're taught what's that thing called now, a little bit of biology, you know, and all that. So yeah, and there was a day at school, they took us to a care home, and when we left that care home, I told my tutor, we call them tutor in college, I don't know if they're still called now, that I want to do voluntary work at that care home, because I wanted to start care work. So yeah, and I was able to do voluntary work there. It was a care home, so I go there, I just, you know, interact with the elderly people there with dementia, and when they are going out, I go out with them and all that. So yeah, so I think I had like 3 months experience, you know, studying health and social care. So yeah, I applied for health HCA at a care home close to my house then, and I told them, look, I want bank, I'm a student, so I can only do bank nights. So I went for the interview, and the interview was quite okay because it was most of the things I was being taught. So yeah, so I started as a night bank staff. Guys, I met so many black ladies there, mostly Nigerians, there were like lots of white ladies there, and you see those white ladies bragging, do you know, I've been in this job for 15 years. My mother also did it. She ended up in a care home. She had back pain. Then I wonder, seriously, 15 years doing this job. Then I didn't really know anything about being a support worker for learning disability, being a support worker for, you know, people with mental health illnesses, being a support worker in the community. I really didn't know, but deep in my mind I was saying, you've been an HCA, a care assistant, for 15 years, for 20 years, and now you've got back pain, and jokingly they'll say, and they are hoping to end up in the care home as well. So yeah, I just couldn't wrap my head around why someone would brag so much that they've been working 15 years as a care worker and they know so much, they know everything. Oh, that lady came 10 years ago and you were the one that, you know, did the paperwork, she's still here and all that. So the more I started, you know, going out, meeting people in college, so I started knowing about the support worker for learning disability, mental health, working in the community, which were a lot easier, more money, room for progression, you know, meeting people, more opportunities. Then I was thinking, why would people just be, look, don't come for me, don't get me wrong, I've done care work, I've been there, I've done that, I've got a t-shirt for it, I've done care work. I'm not saying nobody should do care work. Care work is like the first job you should even do if you want to go into nursing, you want to go into healthcare. Care job, being a care assistant, isn't one of the basic job you should do, because they easily take people. Yeah, so don't get me wrong, I've done care work. Yeah, so I started knowing about these things, and since I've got experience, so I started, so yeah, let's me not rush myself. So I started hearing about these things and all that. See guys, when I go to work as a bank staff, I think I was doing like 2 to 3 nights, you see the amount of clients, service users, I think it was service users who call them there, elderly people with dementia. So the place I was working, it was a big building with like about 5 houses. So in each houses they will have like 40 residents, you know, 40 like that. So because I was a bank staff, I was on float, you know, they want to say float is like you can, so I was doing like 8 to 8 at night to 8 in the morning, or 2 in the afternoon to 2 tonight, 6 hours or 12 hours. So as a bank staff, they float you, they'll tell you work from 8 you know, 8 to 2, then you go and work 2 to 8 like that. And it was hard, you will constantly be on your feet. The only time you rest is that, I think, 45 minutes break or 1 hour break. So you do 12 hours and they pay you for 12, they pay you for 11 hours, 1 hour is break. You constantly be on your feet. They are always short of staff, like you're almost even doing laundry, you're almost even doing the kitchen work, staffs are short. Then you see people getting so tensed up, angry, you know, neglecting service users because the staffs are not enough. Yeah. And the second thing is, there's no room for progression. You are just there. I think maybe they will encourage you, can you do your NVQ level 2, but it's not something they, you know, always bring out. When you go for their training, it's so basic, it's so laid back, it's just like you are there, you are stagnant, there's no moving forward, except you now go out yourself, maybe meet people, they introduce you to other companies or training companies. But in care homes, you are just there. Because when I saw those people who have been here for 10 years and been here for 15 years, they are just there, they are just a care assistant. They've been a care assistant for 20 years. There's no progression. So you will come, be a care assistant, you even train to be a senior care assistant, and they are still there. So what I'm basically saying is, there's no room for progression. It's just there, and there's no room for progression. The money is so bad. I think there are still healthcare jobs that pay £9.50, which I think is crazy, is mental. With so much work, back breaking, your feet are on fire, they are paying you £9.50. Come on, I don't know. See, I remember when I finished a night shift, when I come out from the houses, the office, or I don't know, my feet are it's like I'm literally walking on stones. You know, when you walk on stones, my back will be on fire. So I was telling myself, Sonia, you are so young, you're just in your 20s, and is this what you want to do? Is what you want to do? You are so young. But the thing is, at the back of the mind is, this is what black people do when they come to the UK. So are you not going to, you know, change it? This is what black people do. This is the norm. You met your parents doing it, you know. But mind you, my mom is a graduate now. She just went to uni and she's got a degree. So that's the progression I'm talking about, isn't it? Not just being stuck there. So I started doing research. I said, so look, there was a day, I think the thing that just broke the camel's back is, have you met Nigerian aunties in care homes? There's something about care work to Nigerians. It doesn't make sense. Care work and Nigerians are like 5 and 6. They think some Nigerians, they think they've arrived if they are carers, and they tend to bully you if you are young or you are a bank staff, because I was bullied because I was a bank staff and because they were permanent staffs. Come on, I'm a student. I'm even getting more than you. Not in pay, like more knowledge. I'm going to college and I'm coming to work just to support myself, and you are just there. You are stuck there being just a care assistant. You are not thinking of you know, progressing. The money there is crap. So one day they told me to float. They took me to one of the houses to work. It was a long shift, 8 in the morning to 8 at night. We were short staffed. It was so bad that there was no nurse in charge of that house. About 40 residents, there was no nurse in charge. I think there was no senior carer as well, so it was just us carers, and the workload was mad. It was crazy. So we close at 8. By 7 p.m. we start to, or by 6:30 we start to go around the service users room to change their parts for incontinency, to maybe change wounds and all that. So it was a lot of work, like your back, you lay from your back. So after doing all of this, it was time to take out the bins. So I went out to take out the bins, and while I was coming back, I heard someone screaming. It was as if we're in Nigeria. You know when people scream in Africa, like 2 women are fighting. So I was wondering what's happening. Immediately I opened the door to enter. The woman faced me like she was going to eat me raw. Sonia, Sonia, I'm sorry, I'm going to behave like a Nigerian woman. Sonia, go and ask about me. I will show you in this care home. I will show you in this care home. I will make sure they don't give you job again. Sure, you are a bank staff. You are a bank staff. I'm going to make sure I tell them not to call you for any shift again. I'm going to make sure you will see me today. You don't know me. You young girl. You think you can do this? I just stood there dumbfounded, because I was trying to think, what did I do before I left this door to throw away these bins? What was it? You know, she was just talking on my head. You know how African parents would be talking on your head. She was older, a lot older, so I couldn't talk back. And because of the fact that I was dumbfounded, I'm thinking, excuse me, what did I do wrong? Because obviously the service users are there, you know, so the other people were telling us, calm down, calm down. Not even me, calm down. It was her, because they are the permanent staff. They didn't even tell me calm down. They just like, you go. And that shift that day, I was so quiet. Thank God it was almost time for closing. I was so quiet. She bullied me. She bullied me. And she said, why will you take the bin away when there was so more work to do? I was like, no, my side of, because it's like 2 sides. So she was with another staff. I was, you know, I was like, we'll finish. So I had to take the bin away. A few days later, I was coming for a night shift. So she did a long day. It was a summer evening, so 8 p.m. it was still bright. I saw her coming. I quickly went, and she called me, Sonia, Sonia. Because she's older, I still went to her, and she was like, she was almost kneeling down. Please. I drew back. I don't want trouble, please, madam. I drew back, and she was like, I'm so sorry. That day I was so tired, the workload and everything. I had to put the frustration on you. I had to put the anger on you. You didn't do anything. It's just because we were short-staffed, I was tired, my back was hurting, I didn't know what to do anymore. I was frustrated, I was angry, and I just lashed it on you. I am so sorry. She was like, I'm so sorry, I'm not like that, I'm not usually like that. So just that shift that day was, this woman said everything. One word, okay ma, yes ma, thank you ma. I didn't say. I was still scared of her. I was still scared of her. Immediately she said it, she walked past. I walked past. I had to go my own, because that's some African aunties for you. So yeah, what I'm basically saying is, please, basically saying the reason I left is there's no room for progression. You are just there, so I had to leave, and I wanted progression, so I left and I applied for support worker job, and I worked as a support worker, and I started knowing things. There's room for improvement, you know more things, you get better pay, you know, you start thinking outside the box that okay, one day I want to leave care work, I want to become a nurse, I want to become a midwife. But when you're just at care home, you just like okay, this place is good, we are okay now, we've arrived from Africa, we arrived from Nigeria. So yeah, this is, you know, basically it. So thank you for watching today's video. I hope I've not rant too much. So this is I'm just saying, this is one of the reasons I left care work, and I started being a support worker, and now I am in the route of becoming a nurse. So, you know, yeah, if you love this video, please give it a thumbs up, subscribe to my channel, leave your comment in the section. If you've got any questions, why not ask me? And thank you very much. I'll see you in my next one. Bye bye.